sex hormone binding globulin. It binds testosterone. If it's bound, it's not going to work. You can't spend that money. So you can have a guy with a high total testosterone, and then we need to talk about the labs before this thing ends. The lab values, I'll explain that more in detail. You can have a guy with a high total testosterone, but his SHBG, sex hormone binding globulin, is so high, his free testosterone is in the dirt. If the primary care doc only ordered the total testosterone, he's going to miss that. Another one, and I see this mostly from men who are being treated by other doctors with testosterone replacement, but don't understand that men convert testosterone to estrogen. Men need some estrogen. We need it for our bone density, and we need it for our memory. But too much estrogen leads to man boobs, belly fat, and cardiac issues, and emotional issues. So if a guy's getting testosterone without proper estrogen control, either through the use of supplements or certain prescription medications, the typical story is, "Doc, man, it worked for about 6 weeks. I feel great. Then, I started feeling the dumps." And I'd interrupt and go, "Would you start crying at dog food commercials?" He'd go, yeah, I go, "Well, did it give you anything for your estrogen control?" Blank look. "Did you get a little pill that you took like half a pill once or twice a week?" "No." I get his estrogen is like 120, higher than his wife's ever. So anyway, um, so there's more than just testosterone when it comes to real hormone values, the way what we look at.
Well, I love that because that means that what we're talking about here, and again, just to sum up in my East Texas vernacular, is you're taking a holistic approach to this. Instead, it's not just
Yeah.
as easy as coming in and looking at testosterone levels, going, "Well, you're low, you're high, boom, you're out." It's much more involved than that. So that leads me into the next question, which is, okay, you have this avatar dude that walks through the door. He says, take me for instance, I'm 50 years old, and let's say I start feeling that I'm a little bit more lethargic. I'm not wanting to have sex as often. And so I've decided, Dr. Ibrahim, I listen to the Jason Wright show. I believe in what you're saying. Help me. Where take me through that journey? What's that
Right.
going to look?
All right. So we're gonna get we're gonna get this guy's baseline labs. Biggest reason I have to, like I said earlier, because these hormones are controlled. Now, let me tell you what I'm going to do when I sit down with him with the lab report. You're going to get this lab report, and on one side, you're going to have your values, and on the other side of the page, there's going to be something called reference interval. All right. Doesn't say normal, it says reference interval. That's defined as 2 standard deviations around the mean, which is 95% of everybody they test.
Okay.
So these 2 numbers, let's call them 215 and 946. I think that's what my current lab uses. 215 is at 2.5 percentile. 946 is at 97.5 percentile. That means there's only 5% on either side, 2.5 on each side. The report does not turn to the letter L and say low until you're below 2.5 percentile. This is huge. Many doctors, I'll have patients come in and say, "Doc, I went to see my primary care doc. He got my levels. He said they were normal." I go, "Well, the report doesn't say normal. It says reference interval, and it fell within the reference interval. But if you're at 3 percentile, that's crap. You wouldn't drive your car across the country with only 3% of the oil in the crankcase. Hell no."
Right.
All right.
Right.
But the lab report doesn't say L, or whichever one of these says L. And so the primary care doc might, and this is no diss to primary care doc. My daughter, who practices with me, is a primary care doc. She never learned this in med school either. I didn't learn it. She didn't learn it. So you got to look at where the values fall. And if it falls down on that low end, and they've got these symptoms, they've got low testosterone syndrome. I mean, it's pure and simple. If they are waiting for the thing to say L, they are below 2.5 percentile.
Wow. Wow. And that brings up something that I got to be honest with you, that I took so much for granted, is those, your blood panels and the blood work, and having someone like you to decipher them. Because, and I didn't know this, you mentioned going to a PCP, and again, we're not here to bash
Yeah, at
PCPs.
all. I mean,
You're
they're
good luck.
fantastic.
Right, but you go to one and essentially the blood panel you get done looks it comes out on a freaking PDF. It's got very general ranges for every single category. To your point, if you don't know what to ask for to be included, it will not. And it looks about the same as what you probably saw 30 years ago in practice.
Yeah.
It just until you go to someone like yourself that can truly say, wait a minute, we got to dig down into this and figure out what this means for you specifically. So many people miss so much on those panels.
And, I'll be honest about whenever they were started to require that the lab send the patient's lab reports as big as because it's unfair to the patient. Why are my eosinophils high? Because
Right.
it's allergy season. You're fine. I
Right.
mean, PSA values, that's another example. I'm a urologist. I don't wait for it to turn to the letter H. I'm looking at patterns. Cardiac isoenzymes, I can't read them, but to a cardiologist, they can. It's like Braille to Helen Keller. I mean, so these lab values to the layperson, and the layperson will be freaking out, wondering what's there's an L or an H, and then they don't realize, well, the L in this area is actually what we're shooting for, or the H
Right.
in this area is the goal. You're paying for this.
Right.
Um,
Right.
so I don't know if that answered the lab question correctly, but
Well, it does.
let the provider interpret the labs.
100% and make sure it is a provider that understands what the
Yep,
hell that you
yep.
really need to see. That's the thing that just it goes back to what we were talking about earlier. Like, you talk about in your medical training, how little information was giving on hormones, how little the standard education is on around nutrition for docs. There's so many things that especially as we're moving into this age of where guys like you and guys like my buddy Gus and all these other docs that are focusing on integrative health are not considered whack jobs or kind of weirdos. No, people are now understanding there's this thing we've lived in a sick care versus healthcare system for so many years. So it's going to take understanding these things that beforehand we just didn't even focus on.
Well, and it's gaining like what I do. When I first started, people would say to me, "What are you doing now?" And I tell them, and if they were healthcare provider or doctor, yeah, I knew that they were sitting there rolling their eyes or thinking to themselves, he's a quack or this is voodoo." Well, now it's becoming more and more acceptable. People realizing that there are folks that are coming into this kind of practice that do know what they're talking about. Yeah, there are some charlatans out there, but there are more and more people that are taking the time and learning the true science, not just going to literally in the old days, I'd see these ads, come to Orlando for the weekend, start your hormone practice on Monday. No, I mean, you can't learn how to do something in a weekend.
Right.
Um, and the other thing is, like I said earlier, I stay in my sandbox. If somebody needs the right kind of nutrition, I'm going to send them to somebody that's what they do all day long.
Right.
If they need to go to a real doctor, well, people get upset when I don't call myself a real doctor anymore, but when I want to send them to a real doctor like Gus, that's where they need to go because he knows that kind of medicine better than I do. I'm not going to try to treat somebody's congestive heart failure.
Right. Right. Well, now let me ask you this. So one of the things that always scares me to death about, I guess, is blood pressure medicine. I always hear if once you get on blood pressure medicine, you have to stay on it for the rest of your life. So, by God, I'm trying to stay off blood pressure. I don't take any meds, and I want to stay that way as long as I possibly can. Again, I'm not against pharmaceuticals, but I want to push them off and keep them at bay as long as I possibly can. When it comes to hormone therapy, once I start down this road, does that mean I'm signing on forever and at the same rates? Does it change? Does that mean that you and I, once we start our relationship, we're in it till death do us part? How does that look?
Um, First of all, your testicles aren't going to get any better.
Right.
So if it's time for you to start, then you might as well just realize you're never going to get better than that baseline the day you walked in the door. So, does that mean you're going to have to do it the rest of your life? No, you can quit anytime you want to. Why would you? If you go to Google Scholar, which is a search engine for academicians, scientists, physicians. You type in two terms, testosterone and morbidity, morbidity. Morbidity means major disease. Type those two terms in, hit the return button. You're going to see thousands of articles that pop up. And now they're starting even to include women in these articles. And the gestalt or the overall picture is going to be low levels of testosterone lead to higher incidences of, and then just fill in the blank. Because
Wow.
it's everything from mental diseases to cancers to cardiac issues. It's life saving. Go to women. Um, Women don't have heart attacks before menopause. Women don't get osteoporosis before menopause. After menopause, a woman's risk of a heart attack is identical to a man her age.
I did
That's
not know
huge.
that.
That is
Yeah.
huge. What's the largest, the biggest cause of death amongst women in America? Cardiac disease, not breast cancer, cardiac disease. Why a woman's not on testosterone, excuse me, estrogen after menopause is beyond me. Because th- it's it's it beats not smoking, it beats obesity, it beats not working out. In other words, you can be fat, smoke, and sedentary, but if you're taking estrogen, your chance of a heart attack as a woman is less than the one who's in shape, works out, XYZ, but she's not on estrogen replacement. So there's some life-saving benefits of these hormones, both ways, men and women.